professional solutions to money, relationships, wellness, and more. Shine a light onto your day and into your life. Power Your Life with Dr. Joanne White.
Welcome to Power Your Life. I'm Joanne White, your host. With the face of our healthcare system ever-changing, what's important for you to know so you can receive the best medical care? Here to break it all down is Betty Long, the president of Guardian Nurses Healthcare Advocates. Welcome, Betty.
Thanks, Joanne, for having me.
Oh, it's great to have you here. So let's discuss what was the gap that you saw in the healthcare system that you felt that you needed to fill?
Wow. Well, the gap is really about communication, I think, and it's about talking with patients and making sure that they know what their game plan is. So when I was a nurse in the hospital, I was often brought in on cases where families didn't know what was going on, patients didn't know what was going on, and I thought, you know, there's got to be a way. What are we missing here? Why is it so broken down? So I found the Guardian Nurses.
So what is the role of a patient advocate?
Well, I think the way I look at a role of patient advocate as a nurse is to minimize the hurdles that patients often have, to champion perhaps better treatment, get them what they need, expedite appointments, and be the glue that they don't really even know that they need. Because oftentimes patients don't know what to expect in the healthcare system. So as a nurse, we can step in and really be the guide.
So how have you helped to change patients' lives through your advocacy programs?
Well, let me tell you about a story just this week. It was a young 25-year-old who was admitted to a small community hospital with lesions, new lesions on her brain and her spine. And then when they did a CAT scan, they found a larger lesion on her spine at level of T1, thoracic level T1. And the community hospital started her on a treatment plan thinking she had MS and wanting to do a biopsy of the larger lesion, and we didn't think that was a great idea at that small community hospital, so we suggested to the mom and dad and to the patient, because she was 25, that we expedite a transfer to an academic medical center that specializes in neurosurgery.
So in terms of advocacy, you're also helping the patients kind of figure out whether or not they need the treatment there or if this is the best treatment.
Absolutely.
So
and it's not that we're making decisions for them.
Right, you're helping.
We're suggesting to the parents and to the patient, hey, you know what, there might be a better place to have this done. Just thinking. And then what we're trying to do is empower them to make the decision and to feel like, you know what, I didn't feel so good about being here, so maybe that's why. And I always tell patients, and I know that, is to follow your gut. If there's something that you think is not right, it's probably not right.
So being empowered is so very important, and oftentimes patients forget that they have that opportunity, and not only an opportunity, it's a necessity.
Oh, absolutely. I mean, you're in the hospital, right? You got a doctor telling you have something, and you're passive, you're accepting this information. You don't feel so empowered.
Well, when you feel sick, right, you're leaving everything up to somebody else to make decisions, so you need somebody. Right. Sometimes people can advocate for themselves, but oftentimes they may need someone like you, and your nurses are very, very skilled when they go in. They've had years of experience.
Correct. Yeah, so, they know what questions to ask.
So what kind of, that's good. So let's educate our folks here. What kind of questions do they need to ask when they go into a medical appointment, to the healthcare provider?
Well, I think the first one, if it's a new diagnosis, is, okay, what do you think this is? What are we talking about here? What could it be, okay? And if they then start to answer and respond, okay, what does that mean? Like, I always say, there was a movie once with Denzel Washington in Philadelphia where he said, you know, talk to me like I'm a 6-year-old. Or maybe it was 6th grade.
So break it down a little bit, like legalese, medicalese, so that we can understand what it is that's going on with us, right?
Right. And I often hear physicians talk with patients and they forget to break it down. They'll use the, you know, well, we think you have blah, 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 and it's like, I don't think he knows what that means.
But then the patient leaves and somebody asks, well, what's happened? And they don't understand. They couldn't actually repeat what went on.
And oftentimes, my other experience is that when you're receiving information that's scary, that you don't, and you know this, I mean,
Right.
you don't process it. We had a patient once where the doctor said, you have cancer. And when we came out, I said, what did you hear? And she said, I'm going to die in 6 months. And I was like, oh, no, that's not what he said. No.
So you were actually in the appointment. So that's really a very powerful service.
Well, in that case, it
right?
was too.
Well, also because there was miscommunication or misinterpretation.
Yeah, she just heard, I have cancer, I'm going to die.
Right. So what do you want people to leave the office with in a minute or less here?
Okay, no pressure. What I'd like patients to know is that they need to leave the physician visit with a game plan. They need to know what's the game plan. And I use that as a sports analogy. Okay, so I'm going to do this study, and then I'll take this med, and then I'll do this, so that they break it down, as you said, into little bite-sized pieces. But don't leave the office just saying, okay, and not knowing what the next step is.
I think, too, that if you're not comfortable, it's okay to get a second opinion.
Absolutely. Yes,
And
absolutely.
Oftentimes people don't think so.
Yeah, no, in 30% of the cases where you get a second opinion, things change. So I absolutely
So then
agree.
who do you believe?
Who do you believe? Well, then get a third opinion.
Okay, so whatever, until you feel comfortable.
Break the tie.
Until you feel comfortable.
Absolutely. No, I think it means your health care, right? I mean, that's the
Right.
whole premise of what you preach.
Yes. Betty, thank you so very much.
You're welcome. Thank
My
you for
pleasure.
having me.
My pleasure. When we come back, we're talking about diet and exercise with celebrity trainer Gino Cacavelli.